Dear all, this is a very special session. Sex, sexuality and the gynecologist. It is my proud privilege to invite our Foxy President, DrJaideepTank, to join with Jaideep sir. We have two more faculty.
Dr. Sita Lakshmi, Madam is a gynecologist and sexual medicine practitioner. She is a YouTube influencer with over 1.3 million subscribers, a hypnotherapist, sexual education advocate, seminar leader for pre and post-marriage workshops and seminars, public speaker on Doordarshan, Josh Talks and other platforms.
We have one more guest, Advocate Remya18-08-24, holding the post of Chief Judicial Magistrate Thrissur. Over to you, Venugopal sir and Bindu madam.
Very good morning, all of you. As gynecologists, what happens invariably is we are more concerned about the physical aspects of a woman's health. Whether sexual issues and sexual health, these things remain under the carpet or they are hidden or discussed in dark fora. So we thought, in the middle of all your slides and your role play and serious discussion, we will have a discussion regarding this topic. And we have three people of eminence, to grace the stage and to share their experiences and thoughts about it. Jaideep sir, the biggest credit to him is, more than anything, he's the biggest champion for women's rights. And I think he needs a big round of applause for that. One person who has harnessed the power of the social media to the hilt. Please have a round of applause for Dr. Sita Lakshmi. And both the providers of service, that is we gynecologists, as well as our patients, need to understand that there is a legal framework under which we need to operate and we need to be aware about. And there is no better person to discuss that with us and give inputs than Advocate Remya18-08-24. Welcome, and please give her a round of applause. Over to you, Bindu, to set the ball rolling.
First of all, Sita madam, you are a YouTuber and you are a gynecologist. Now you are practicing only sexology. So what is the difference do you feel while practicing as a sexologist?
Thank you for the question, Dr. Bindu. Yes, as I transition from being primarily a gynecologist to now almost fully a sexual medicine practitioner, I am coming to realize that there are so many challenges that we are facing, and there are so many things that we did not know about sexuality. So we have been thinking that maybe unintended pregnancies or pregnancy-related issues, STIs, and maybe abuse-related issues are the only things that are of concern. But no, it's just the tip of the iceberg. There are so many issues like sexual paraphilias, arousal disorder, desire disorder, orgasmic disorders, pornographic addiction, masturbation addiction, the list is endless.
Can you brief few of the challenges you have faced?
Well, the most important thing is many people who have sexual health concerns, they are not able to articulate their problems properly because they themselves don't understand what issues they are facing. They have so many misconceptions, and there is so much of societal stigma and taboos. And more than the patients, we doctors, we ourselves don't know how to articulate. I mean, when they come and tell us, doctor, I have got this issue with masturbation, or maybe I have been practicing this particular type of sexual activity, when we just respond with an expression, oh, is it like that? Then that is it. They will shut off. So that was a great challenge for me in the initial days. And initially during the COVID days when online consultations were permitted, so many people used to take video consultation, and I was scared to take video consultation.
Is a gynecologist good at sexual medicine?
Actually, social media gives us a leverage, because the patients, even before they take consultation, they know that, okay, they can talk to us and that we are non-judgmental, provided we give them this thing.
I think the question is whether gynecologists are good at sexual medicine or not. I think the short answer is that we aren't trained properly for it. We tend to look upon sexual medicine as more medicine and less sex. And we don't tend to look at it from the framework of women's rights. And I think till we don't get that context right, I think we will always struggle with articulating emancipation of women.
Yes, I think that's a very significant statement from somebody sitting on top of a body of professionals. And we congratulate you for that in your statement.
Sita madam, can you brief what are the different types of sexual problems do you encounter in your practice?
There are some problems which are common across all age groups, among all socioeconomic strata, whether they are educated, non-educated, whether they come from rural area or urban area. And there are some age-specific issues also.
So any special issues when you are dealing with adolescent and young girls?
Actually, what I have personally felt is it is very, very difficult to understand what exactly the adolescent girls' concerns are, because most of the time they don't have a proper platform where they can express their concerns and where they can look for a proper answer without being judged, you know.
Last week I had a patient. She is a 16-year-old girl. This is to Remya ma'am. 16-year-old girl. She came with discharge PV. And she very proudly, she told me she is sexually active. Should we inform the police? That's one question. Or when she is pregnant only, we have to inform the police.
The consent is not a parameter. Children under the age of 18 is concerned. You know that she has been subjected to some sort of sexual activity and it involves another person. You have to inform that to the police. That is what the law says. Because if you don't inform, it is an offense.
So that is a very important answer.
I think it is quite unfortunate, even though it is the law and we have to enforce it, our children have no platform to express themselves. Yes. It is, it is a closed gate at that point.
Jaideep sir, you would like to make a point, your hand raised.
The question that we always face, of course, is at what age do you judge that the adolescent is mature and is now able to judge for him or herself? And that is something that we are struggling with. So any suggestions on these are welcome. We are going to come out with a statement.
Living together. Now we would like to have few observations from each one of you on this particular concept.
On a lighter note, living together is not limited to young couples.
That's fine. Okay, I give it to you.
It is for anyone. It can be at any age.
Yes.
The legal implications of living together is that a person who already has a legally married wife cannot live in together.
Yes.
That is not living together. That is, committing adultery. And please don't have the misconception that it is limited to metros, it is limited to certain age, it is limited to somebody. You might be alarmed to see that living together was prominent in Idukki in the tea estates.
I wanted to emphasize on that point which Advocate Remya Madam said. That is, many of us have got this misconception that living together is among the metro people only. No, it is not at all true. And another thing what I have realized, or maybe what I've observed, is many people are opting for this living in relationship because they want to shun the responsibility that marriage brings with it. Yes. Especially in India, marriage is not just between two people, it's between two families. And they don't want to have this baggage. That's what people tell us. That is, we don't want any extra baggage.
Sir, when they come and tell you awareness about contraception in all these things.
So given that I'm not an influencer or a lawyer, I'll just say this, that whether someone is living in or married, the medicine doesn't change.
Yes.
The medicine remains the same.
Yes.
The advice that you give them in terms of contraception, abortion if it's required, even pregnancy and birth remains absolutely the same. There is no difference at all.
Correct.
The only extra thing that I would like to say is that if someone tells you that they are living in, please don't raise your eyebrows. It's none of your business.
That is what I would like to say. That is, we should be not judgmental. We are no one to judge anyone else.
Non-judgmental. I think this throughout with the common
non-judgmental, totally non-judgmental.
The thread for our Jaideep, sir, you hit the nail on your head, and we were discussing with Sita madam before, and then she was telling this word 10 times. That with the difference in a gynecologist is sometimes we tend to be judgmental, that we tend to pass our views and thoughts about it.
See, when we deal with patients or people who have sexual health concerns, we cannot just diagnose and then maybe prescribe some medications and do some surgical intervention. We need to foster an environment where they feel safe, supported and respected. That's very, very important.
Yesterday, Venu was complaining, most of the infertile couples, they are going to see the Lakshmi madam. So he's not getting any patients.
So, I have IVF.
What Sita madam has to say?
That's not the situation. That's not the situation. I do IOI, I do IVF. I have a lot of medicines with me. But I see that many patients are gone to Dr. Sita.
She's dealing with most of the infertile couples.
She's treating them, keeping them for 10 days, I don't know, buying salwar kameez for them, and they're coming with pregnancy and saying, count, you said like this.
Dr. Venu, the thing is, how frequently do you ask people whether they have actually consummated their marriage? Because that is a problem. Many couples with fertility issues, many of them have marriages which are still not consummated, and vaginismus is much more frequent than we can ever imagine. Can you believe that I get at least 30 new vaginismus patients every month?
Yes. So she is seeing 30 new vaginismus cases every month. Jaideep sir, we are all practicing infertility and...
so that's just one doctor. So just imagine how many vaginismus patients are there throughout the country.
Jaideep sir, as any message, a lot of people laughing in the audience also, probably they feel, as infertility specialists, do we sometimes miss the basics? Many times patients don't tell these things. So any specific message to, as a gynecologist, that the mistakes we made in fertility? Because sometimes it's ridiculous. A non-consummated patient goes and has IVF 3 times, 4 times.
So I think it is an important issue, and I think the issue is not only about vaginismus. I think it's a broader issue of unconsummated marriage.
Yes.
And the problem is that we perhaps don't always delve into the sexual history. Having said that, I think the issue which I have seen, because perhaps we are in a very urban environment in Mumbai, is reduced frequency and libido.
Yes.
I think that's really become a very, very major issue.
Yes.
Particularly with, men and women working different shifts, day, night, etc., etc.
Yes.
And sometimes there is a tendency to tell them that let's finish the fertility treatment, get on with it, and then come back and address the issue.
Yes.
And I think the motivation to address this issue is strongest when they are trying to have a pregnancy, and perhaps that is the right time. We shouldn't push it under the carpet and say we'll talk about it later.
Once they have a child, then at least for the next 10 years, they are not going to have this issue addressed.
That is Sita madam, one more common question. Is there any role for injection, Botox and hymenectomy? Vaginismus.
In many conferences, we see people advising Botox for refractory cases of vaginismus. But what we have personally observed is, in early stages of marriage, when the condition doesn't subside, or when the condition doesn't get cured by counseling, or maybe by dilators or fingering, then maybe Botox is beneficial. But if the marriage has been there for a few years, what happens is, many a times both of them would have lost interest in foreplay and other activities, and the man would have developed erectile dysfunction also. At that time, if you do just this Botox injection, it's not going to help.
It's not working.
And another thing, one point is, many people do get hymenectomy done for vaginismus. See, only when it is really indicated, hymenectomy can cure vaginismus, otherwise no. And the patients are then thrown into more trauma because they think that they are doomed for life.
I'll ask the legal expert on consummation, erectile dysfunction. Are they per se grounds for divorce?
A marriage is supposed to be complete only after consummation. Non-consummation makes the marriage voidable at the instance of any of the parties. It is not divorce that we grant. It is said that the marriage does not exist in the first place. That is the order that the court gives. Impotency is a ground for annulling marriages and the consequential non-consummation. The problem is, impotency is subjective. It might be towards a person, a situation, etc. We ask for potency tests, but it is seen that the potency tests are not actually the potency test in the sense of this definition.
Yes. Any points, sir?
I just think it's a very sad situation. And most of the times the situation perhaps occurs because the patients feel there's no alternative. Or they're not aware that a treatment or some kind of counseling, etc. can actually solve the problem. They may not necessarily be incompatible. And this might be the sole reason why they are separating. And I think that's why it's important for people like you to bring more awareness and perhaps go to 2 million followers.
I would like to add one more thing. In a country where being sexually active till the age of 18 is an offense, you cannot expect people to be aware of all these things.
Exactly.
That is one of the major issues, because in our country at least, matters related to sex, they are not spoken openly. And immediately after the marriage, from next day onwards, you are supposed to know everything and have a PhD on that.
Exactly.
How is it possible?
And And I put this on the discussion for few things. So the gynecologist, you may not be able to deal with it, but I think the documentation and your case reports and filing is very important.
Yeah, one more question to Jaideep sir. PCOS and endometriosis, can it affect the sexual life?
Endometriosis certainly, because it causes painful intercourse and it will definitely affect frequency and libido.
Yes.
PCOS actually affects it in a, indirect way.
Yes.
Because if PCOS results in infertility, and over a period of time we have seen that patients who are infertile and trying for a long time find it increasingly difficult to maintain libido and frequency. Yes. So PCOS indirectly, endometriosis directly.
Yes. Sita madam, you want to add something?
Yes. See, when women, be it young girls, that is adolescent women, or maybe married women, whoever who has got PCOS, they have additional issues related to sex, because sex is not just about intercourse. Sexuality encompasses a wide this thing, and it's more than 70% emotional. Only 30% has the physical component, So many of them have this poor body image because they are obese or because they are very lean, they have hirsutism, they have dark thighs. So what will their partner think? All that puts them off and their desire
hit
drops
the nail
down.
on the head. I think yes, image and this thing, all these things matter a lot. Is it not so? That's very true.
Sita ma'am, 50 is the new 20.
Okay.
What's your opinion and comment on the reclaiming intimacy?
Yes, reclaiming intimacy is very, very important. It's not entirely sexual, but at very different levels. Again, I'd like to emphasize that sexuality is not just about sexual intercourse. It is a form of total intimacy, sensate focus therapy. I think all gynecologists should know a little about sensate focus therapy, and we should advise our patients how to do it, how to go about it. Because after 50, many people will have physical disabilities, physical issues, erection problem, vaginal dryness. So sensate, they can start with sensate focus and then they can reclaim their intimacy. So after menopause and after hysterectomy, sexual life is completely stopped. No.
Thank you. We really wish we had more time to carry on this discussion.
Dr. Venu, may I just say one sentence?
Yes.
Dr. Venu. Just one sentence.
Yes, one nalla parnolu.
See, I know that most of us gynecologists in our busy obstetric practice, especially when we are practicing obstetrics, we do not get enough time to spend with the patients. But if a patient comes with sexual concerns, at least let us try to not just minimize their concerns and just say, oh, that's all normal, and what is special about you? And let us avoid making insensitive remarks like, if you do not, that is, comply with your partner, and if you do not agree for sex, then your partner will divorce you or he'll go behind some other women. Such comments let us not make, and please let us refer to a specialist if we cannot handle it. And only if we have dedicated time and only if we have a real passion for this, we should take up sexual medicine. Otherwise, it's...
Yes, thank you. And Dr. Sita Lakshmi and Advocate Ramya, we are very fortunate that both of you are based here in Thrissur. And then, we have a quick one-stop solution to problems we can't deal with. And Jaideep sir, I am very proud to be a part of an organization which has you as our president. Thank you very much, sir and madams, and all of you for this.
Thank you, Dr. Bindu Menon and Dr. Venugopal sir, for their exceptional moderation. I would like to thank the experts, Jaideep sir, Sita Lakshmi madam, and our CJM, Remya madam, for their invaluable insights.
Actually, when we call doctors for being speakers or like chairpersons, it's with so much of hesitancy that they accept it, and there is so much of taboo around it. So what can be done for that? Actually, I had talked to Apurva also about this, but we find it really difficult.
They'll be likely say no. They won't say no then.
So Sita madam and few others are there who accept
Absolutely.
it. But
the problem here, I don't think is the fact that it's taboo. The fact is, as I already said, that we aren't trained properly. And there is a hesitancy to speak about it if you're not trained properly. Tomorrow, if I'm going to speak on something like, say for example, recent advances in CA ovary, I'm not an oncologist. I will not be the right person. Now, because I'm the president, I will accept it and speak about it, but obviously I won't do a very good job out of it, which will then make me hesitant to speak about it next time. So as I said, it essentially boils down to training and awareness more than the taboo part, at least as far as gynecologists